Hello everyone and welcome to our final oral presentation. Today we are talking about a modern and innovative approach to treating autism spectrum disorder or ASD, auditory neurofeedback using the Mente Autism device. Before we begin, we would like to introduce a few terms that you need to know for follow our presentation. The first is neurofeedback. Neurofeedback is a non-invasive technique that uses the real-time brain signals or stimuli are playing in to improve the self-regulation. The next is binaural beats. Binaural beats are special tones perceived when different frequencies are playing in each air, which can influence the brain activity. EEG or electroencephalogram is a method that records the brain electrical activity, especially the electrical activity. And we also mentioned postography, which is used to measure balance and motor control. And finally, the self-regulation. The self-regulation is the ability to manage one's emotions and behavior, which is often challenging for individuals for ASD, especially the behavior, the emotional regulation, and the social interaction too. We choose this topic because as a psychology student, we are interested in innovate the evidence-based treatment that can support emotional development and behavior in children with autism. The article we based our presentation obviously is a clinical trial that studied the effect of this device in children diagnosed with ASD over a 12 weeks period. This device is small, portable, and it's a headset that includes EEG sensors to detect the abnormal brainwave patterns, brainwaves like alpha, beta, theta, gamma. When these patterns are identified, the device delivers customized auditory stimulation and improve overall neural regulation in patterns. Children in the study use the device for 45 minutes each morning, daily obviously, and at the end of the trial, those active group show improvements in EEG activity with emotional behavior, physical balance, and in general better health, mental care.
These results are significant because they show that home-based, non-invasive therapy can have real measurable effects on the development and behavior of children with ASD. This is important because it means families can help their children improve from home in a more relaxed and familiar setting. This type of intervention offers families a flexible and accessible option, especially for those who may not have easy access to specialized psychological services. It gives more people the chance to access therapy even if they live far away or can't attend to regular appointments. From our perspective as future psychologists, this device represents the potential to expand the way we treat neurodevelopmental disorders. It's a new tool that can support traditional therapy and offer more options for children with different needs. It doesn't replace therapy, it supports it. This is key It works alongside what's already being done, and it helps make therapy more effective. In many cases, children who struggle with traditional behavioral therapy may benefit from a tool like this that works directly with brain function and enhances focus, emotional control, and cognitive flexibility. It's another way to help kids who need extra support in areas like attention and self-regulation. It's also important to highlight the role of technology in modern mental health care. Technology is making therapy more flexible and helping professionals stay connected with the families. Devices like Mente Autism make it possible to monitor and support a child's brain activity without needing constant clinic visits. This saves time and gives family more independence while still keeping professionals involved. That means more consistent therapy, greater autonomy for families, and opportunities for professionals to adjust treatment in real time using cloud-based data. It helps therapy stay on track and be more personalized. In conclusion, auditory neurofeedback with the Mente Autism device is an exciting and promising addition to autism treatment. It's a good example of how science and technology can improve mental health care. It reflects the growing trend of combining psychology and neuroscience with user-friendly home-based technology. It makes treatment more accessible and easier to use. As future professionals in mental health, we believe it is essential to explore and promote interventions that are both effective and accessible. We need to support tools that make a real difference in people's lives. Thank you for your attention.